Welcome to the module on the neurobiology and genetics of addiction. The contributors to this module are Dr. Jamie Rivera in the nursing department and Dr. Robin White in the biology department at Westfield State University. During this module, we will give an overview of the neurobiological and genetic mechanisms of addiction, specifically nicotine, in the context of a case study on teen vaping. All behavior, including addictive behavior such as vaping, is ultimately dictated by what is happening in the brain. Before we get started on the case study, we will be covering some basic neuroscience background that will be useful as we discuss the neuroscience behind our case study. It is estimated that there are about 100 billion neurons in the human brain that communicate with each other so that the human body can function. On the left, you'll see a diagram showing 3 different neurons. Here's neuron number 1, neuron number 2, and neuron number 3. If you look first at the center neuron, shown here, you will see the information travels via an electrical signal from the cell body, which is shown here in orange, through the axon in red, to the other side of the cell that is referred to as the end of the axon. Between each neuron pair is a small space called a synapse. This is a zoomed in image of a synapse. What you can see is that the axon of one cell forms a tight, close contact with the dendrite of another cell. Once that electrical signal travels to the end of an axon, it triggers that axon to release chemicals called neurotransmitters, which are stored here in vesicles at the tip of the axon. Receptors for these neurotransmitters are located on the dendrites and trigger an electrical signal to pass down the axon and so on and so forth. This process is happening all the time throughout the approximately 100 billion neurons in your nervous system. And this release of neurotransmitters at the synapse dictates whether or not a signal will be communicated from one cell to another. I'd now like to talk about some brain anatomical structures that are going to be discussed throughout this module using a tool called the FINR Brain Atlas of Injury and Anatomy. The link to use this free tool is located at the bottom of this slide. This will allow us to view the 3-dimensional structure of the brain and give you an idea of where these different structures are that I'll be discussing as the presentation goes on. So this is a side view of the brain. Using this tool, we can rotate it around a bit. This is the frontal lobe, which is where the forehead would be. And this is the occipital lobe, where the back of the head would be. So the frontal lobe is a very, very large portion of the human brain that's responsible for higher order functioning, such as decision making and abstract thinking. And the frontal lobe includes a brain region called the prefrontal cortex that plays a role in addiction that we'll be discussing. And the prefrontal cortex is located right here in the frontal lobe. Another area of the brain that we're going to be discussing is something called the nucleus accumbens. So the nucleus accumbens is in a part of the brain called the basal ganglia. The basal ganglia is involved in voluntary movement, and it's also involved in addiction. So these 2 little green structures here are the 2 nucleus accumbens. And as you'll see in the next couple of slides, I'll be talking about the role that they play in the brain reward pathway. Another region that we'll be talking about is in the brain stem. Specifically, it's an area called the ventral tegmental area that's located in the midbrain. So this small part of the brain, which is really deep in the core of the brain, is referred to as the midbrain. and it includes the ventral tegmental area, which is where the brain reward pathway really begins. The last structure that I'd like to show you is something called the limbic system. So the limbic system is a group of structures in the brain that include things like the hypothalamus, which is involved in their fight or flight response, the amygdala, which is incredibly important for emotion, and the hippocampus, which is vital for memory formation. Specifically, we'll be talking about how the amygdala is involved in the negative affect part of drug withdrawal. So that gives you a general idea of where these different structures are that we'll be talking about. As I mentioned on the last slide, the nucleus accumbens, shown here in green, is a part of the brain primarily responsible for addictive behavior. This was first realized in the 1950s when James Olds and Peter Milner did a series of experiments in which rats were implanted with electrodes, which are shown here and attached to an electrical cord, in different parts of their brains, and trained to push this lever in order to get a little jolt of electricity. As you recall, the brain communicates through these electrical signals. So having a jolt into your brain would mimic a stimulus that causes activation of a neuron. In these experiments that were published in 1956, they found that rats with an electrode implanted into the nucleus accumbens would hit this lever up to 2,000 to 5,000 times per hour in order to get the rewarding sensation. And they would do this in lieu of eating or drinking, even if they were deprived of food and water for the duration of the experiment. Since this early experiment in the 1950s, there have been multiple additional studies that support the idea that the nucleus accumbens is a major part of the brain's reward center. The nucleus accumbens in the basal ganglia is activated any time that we get any type of reward, including drugs, food, sex, or any potentially addictive behavior. However, in order to get access to those stimuli, we need other parts of our brain, such as the prefrontal cortex, located in the frontal lobe. The prefrontal cortex is divided into two regions, dorsal and ventral. The dorsal, or top part of the prefrontal cortex, is responsible for cold functions, such as higher order reasoning and impulse control. In this publication from 2011, the dorsal prefrontal cortex is shown in blue. The ventral, or lower prefrontal cortex, dictates hot functions, such as behavior driven by emotion, and in this schematic, it is shown in red. Normally, in a healthy state, such as in panel A, only a small portion of either the dorsal or ventral prefrontal cortex, which is shown by these darker colors, is responsible for drug-related functions. The cold overpowers the hot and tells you to stop or prevents a drug-related behavior. When someone is undergoing craving or withdrawal, such as in panel B, more of these brain areas become active with drug-related functions, and the ability of the prefrontal cortex to override the ventral prefrontal cortex becomes diminished. During intoxication and binging, shown in panel C, the majority of the prefrontal cortex is engaged in drug-related functions, and the ventral prefrontal cortex, driven by emotion, is the predominant influence. Activation of both the nucleus accumbens and the prefrontal cortex starts in the ventral tegmental area, or VTA, of the midbrain. Those rewarding stimuli, such as drugs, trigger neurons in the VTA to release the neurotransmitter dopamine, shown here, which activates neurons in both the nucleus accumbens and the prefrontal cortex. If we zoom in on one of the synapses in this reward pathway, we can see that we have an axon here and a dendrite here. Within the axon, there would be dopamine that is stored in the vesicles, and in the dendrite, we have receptors for that dopamine. Any rewarding behavior, such as food, will result in a release of dopamine, shown by orange circles, into this synapse. Addictive drugs, with cocaine, shown here as an example, are going to cause a major increase in the amount of dopamine in the synapse. This will cause overwhelming feelings of reward when the VTA communicates with the nucleus accumbens. Now that we have some of the neuroscience basics down, let's get started on our case study.
This is a short video that gives a greater insight to the vaping epidemic. This was taken from truthinitiative.org. It is a nonprofit organization with a mission to achieve a culture where all youth and young adults reject tobacco.
In case you're new, everyone at my school, Jules.
Something that is literally sweeping the nation. Everywhere I go, it is a whole thing.
Yo, what is going on, guys?
Today's video is gonna be a Juul sesh. We got the mango pod,
The cool cucumber.
Fruit medley.
I've got this creme pod because I thought it would be festive.
It tastes great.
Well, if you want a head rush, definitely the Juul.
It's really strong.
My God, bro, give me the biggest nick push.
Oh my god. The Juul challenge. You gotta hit this thing as many times as you can. We're doing the Juul Hotbox Insane Nick Buzz Challenge, you dig?
I got some accessories.
Juul wraps. Type in charging case for Juul.
Rolo bag. Sword drop.
Ghost stick.
This one is watermelon. It is literally so good.
Above is a picture of the different types of e-cigarettes. The most common used by teens is the Juul, which is shown here. Juul is a brand of e-cigarette that is shaped like a USB flash drive, shown here. Like other e-cigarettes, Juul is a battery-powered device that heats a nicotine-containing liquid to produce an aerosol that is inhaled. All Juul e-cigarettes have a high level of nicotine. According to the manufacturer, a single Juul pod contains as much nicotine as a pack of 20 regular cigarettes. There is a widespread use of Juul by students in schools, including classrooms and bathrooms. The smaller device next to the Juul is the charger, which looks like the flash drive, and the computer. E-cigarettes are electronic devices that heat a liquid and produce an aerosol or a mix of small particles in the air. As you can see, e-cigarettes come in many shapes and sizes. Most have a battery, a heating element, and a place to hold a liquid. So how does an e-cigarette work? E-cigarettes produce an aerosol by heating a liquid that usually contains nicotine, flavors, and other chemicals that help make the aerosol. The liquid is used in e-cigarettes often contains nicotine and flavorings. Teens often refer to this as an e-juice, e-liquid, vape juice, or vape liquid. When a teen inhales the e-cigarette, the aerosol goes into the lungs. Anyone standing next to the teen can also breathe in the aerosol when the user exhales it into the air.
So now you know a little bit more about teen vaping. You may be wondering what exactly is in the vape juice, the liquid that's used in e-cigarettes and Juuls. So first off, I'd like to note that Vaping and e-cigarettes are not currently regulated by the FDA, so this isn't always a straightforward answer to this question of what is in the vape juice. However, most vape juices have 4 major ingredients. The first is water, the second is some sort of flavoring, and the third is either propylene glycol or vegetable glycerin. Both of these are solvents for ingredients in the vape juice. And finally, the juice may or may not contain nicotine. Nicotine, which is shown here in the vape juice, is what makes it addictive. When nicotine is absorbed into the brain, it activates what are called nicotinic receptors. Shown here are 2 different views of the receptor, which is shown as a protein diagram. This receptor is basically a cylindrical shaped tube that crosses the cell membrane, and when it's activated by nicotine or other ligands that are naturally occurring in the brain, it will allow charged ions to pass into the interior of the cell and begin the electrical signal from the dendrite to the axon. These complex protein receptors are a combination of 5 different subunits, which can exist in a variety of conformations. For example, you can have a receptor that is made up entirely of the alpha-7 subunit, which is shown here. This particular version of the receptor has 3 beta-2 subunits and 2 alpha-4 subunits. This one has 5 different subunits: the alpha-4, beta-2, alpha-6, beta-3, and another beta-2. The addiction subunits, or those that have been identified as being implicated in nicotine addiction, are beta-2, alpha-4, alpha-6, and alpha-7. We will be speaking about some of these subunits again whenever we talk about the genetics of nicotine addiction. When nicotine enters the brain, it will bind to nicotinic receptors in the ventral tegmental area, or the VTA, of the midbrain. When the nicotine, which is shown here by these circles, reaches receptors, it will cause an influx of ions and result in a release of dopamine that can then activate other areas such as the nucleus accumbens and prefrontal cortex. This results in a feeling of reward and a desire to do the behavior again. When the brain is flooded with dopamine, it compensates by decreasing the number of dopamine receptors. This image is of a brain's PET scan that show dopamine receptors. Red areas indicate more activated receptors, and blue areas indicate fewer receptors. As you can see, someone abusing methamphetamine, as shown here, has fewer activated dopamine receptors than a non-user, shown here. This results in decreased sensations of reward with day-to-day activities, such as eating, and means that more drugs will be needed to produce a feeling of reward. However, this change is reversible. 2 years after detox, levels of dopamine receptors are similar to that of a non-abuser. Vaping and e-cigarettes have been marketed as a safer alternative to cigarettes, but recent studies have shown potential harmful effects of nicotine alone. For example, on a molecular level, a 2017 paper showed that nicotine and nicotine-derived nitrosamine ketone, which is shown here as NNK and is a metabolism product of nicotine, decreases DNA repair and increases the mutation frequency of DNA in human lung and bladder cells that are grown in cell culture. While it doesn't significantly increase mutation in normal DNA, shown here, DNA that's already been damaged from radiation, which is shown here in the middle, or hydrogen peroxide over here on the right, becomes even more mutated when exposed to either nicotine or NNK. While not regulated by the FDA, e-cigarettes have been reviewed by the FDA. And interestingly, it was found that many pods contain nicotine, even if they were labeled as not containing it. Flavorings, although safe when consumed, may or may not be safe when inhaled. One example of this is diacetyl, used to flavor microwave popcorn, that is linked to lung disease. Propylene glycol, one of the solvents that is often found in e-cigarette juice, can potentially cause lung irritation. Other substances may be released when the pods are heated, such as formaldehyde, a chemical used for tissue preservation that is a potential carcinogen. E-cigarettes can also include particulates, such as heavy metals, that are inhaled. Since vaping is a relatively new trend, the long-term effects are not yet understood. However, more healthcare practitioners are becoming aware of the health risks that can result from vaping. Specifically, this case study, hypersensitivity, pneumonitis, and acute respiratory distress syndrome from e-cigarette use, was recently published in the journal Pediatrics in 2018. This case study described an 18-year-old woman who experienced acute respiratory distress, also known as wet lung, 2 to 3 weeks after beginning to use e-cigarettes. This is a life-threatening condition that prevents the lungs from absorbing oxygen.
We will now begin an unfolding case study. This case study will evolve over time and help the learner to critically think about the presenting problem along with the potential next steps. So let's begin. Nathan is a 16-year-old male and is a junior in high school. He started vaping approximately 1 year ago after some of his friends encouraged him to try it, telling him it was safer and not addicting like regular cigarettes. Over the past year, Nathan has increased his use with vaping and is now vaping several times a day, before, during, and after school. He has spent all of the money he earned from his summer job on buying flavored pods and has almost depleted his savings account. He has to start selling some of his more expensive shoes that his parents bought him to help support what he considers a hobby. Nathan's parents have noticed that his grades have started to slip from mostly A's to B's and C's. He has become more withdrawn from family and lacks motivation, spending a fair amount of time in his room. His parents have asked if everything is okay, and Nathan often becomes defensive and almost explosive with his temper. His parents are unaware of that he is vaping and have chalked it up to a change in behavior as normal adolescent mood swings and hopes it will pass with time. His parents have been married for 19 years, both work, and are former smokers. Recently, his mother found what she thought was a flash drive charging in a power outlet. When she asked him about it, he denied vaping and said it was one of his friends. So if we reflect now on this scenario, what are some of the concerns that the provider would have about Nathan? And this would help the provider establish a plan to move forward. For this scenario, here are some of the key concerns. Juuling for the past year, increasing in frequency of the vaping from occasionally to before, during, and after school. Nathan not recognizing that this is a problem. Selling his belongings to support the addiction, however, what he thinks is a hobby. Decrease in grades. Changes in behavior. Parents who were former smokers. And possibly parents that are unaware of risky behavior. So now we're going to talk about what some predisposing factors could be for addiction, and we will cover biological, psychological, and environmental factors. Predisposing factors are defined in these models as factors that exert their effects prior to a behavior occurring by increasing or decreasing in teens' motivation to undertake that particular behavior. Unfortunately, when it comes to teens and nicotine, parents just can't gaze into a crystal ball to find out whether their teens will face problems with drug use in their teenage years. But there are biological, psychological, and environmental factors you can watch out for to help you figure out if your teen may be at greater risk for addiction. It is important to keep in that mind that risk factors do not determine a teen's destiny. Instead, they provide a general gauge as to the likelihood of drug use. But it is safe to say that addressing risk factors early and paying careful attention to children at higher risk can reduce a teen's likelihood of a future problem with drugs. Understanding risk factors is also very important when a teen with more risk has already experimented with substances or has a problem. So now we're going to go through a theory burst and discuss some of the biological, psychological, and environmental factors that could happen with addiction. We'll first discuss biological. A healthy home environment during childhood is essential for reducing the risk of addiction later. Being around authority figures and family members who use drugs can increase the likelihood of developing a substance use disorder later in life. Addiction isn't a matter of weak willpower or lack of morals. The chemical reactions that happen in your brain when you have an addiction are quite different than those that happen in someone without one. Drug addiction is more common in some families and likely involves a genetic predisposition. If there is a blood relative, such as a parent or sibling with drug addiction, there is a greater risk of developing a drug addiction. Some of the psychological components we will discuss now. The increasing influences of friends and peers throughout a person's teenage years can have a significant impact on whether or not they use drugs. In addition, children who have a history of traumatic events, such as witnessing a car accident, experiencing a natural disaster, or being a victim of physical or sexual abuse, have been shown to be more at risk for substance use problems later in life. Therefore, it is important for parents to recognize the possible impact of trauma on their child and get help for their child to address the issue. Lastly, children who frequently take risks or have difficulty controlling impulses are more at risk for substance use problems. While most teens understand the dangers of taking risks, some have particular difficulty resisting impulses to engage in risky behavior, especially as teenagers. And lastly, environmental. Environmental factors can also raise your risk for addiction. For teens, lack of parental involvement can lead to a greater risk-taking or experimentation with alcohol and other drugs. Young people who experience abuse or neglect from their parents may also use drugs or alcohol to cope with their emotions. Peer pressure is another risk factor for addiction, especially among young people. Even when it's not overt or aggressive, pressure from friends to fit in can create an environment of experimentation with substances that can lead to addiction. The availability of a substance in your social group can also affect your risk of becoming addicted. For example, large amounts of alcohol are available in many social settings that are popular among college students. Now we're going to kind of review the nicotine brain. Although our society currently finds itself focused on the tragic epidemic of opioid overdoses, there remains no better example of the deadly power of addiction than nicotine. The measure of a drug's addictiveness is not how much pleasure or reward it causes, but how reinforcing it is. That is, how much it leads people to keep using it. Nicotine does not produce the kinds of euphoria or impairment that many other drugs like opioids or marijuana do. People do not get high from smoking cigarettes or vaping. Nicotine is a stimulant drug found in the vaping pods. Nicotine is highly addictive. In fact, it is addictive as heroin or cocaine. When inhaled, nicotine reaches the brain within 8 seconds. Its effect on the body include increased heart rate and blood pressure, increased alertness, and reduced appetite. Drugs interact with the reward center in the brain to release strong, good-feeling emotions, affecting the individual's body and mind. Our brain rewards us when we do something that brings us pleasure. To illustrate, individuals keep taking drugs to support the intense good emotions the brain releases, thus creating a cycle of drug use and intense highs. Eventually, they take the drug just to feel normal. There are probably several reasons why nicotine is so reinforcing, even if it is not as intensely rewarding as other drugs. Like other drugs, nicotine stimulates the release of dopamine in neurons that connect many regions of the brain. This dopamine signal teaches the brain to repeat the behavior of taking the drug. The amount of dopamine released with any given puff of a vape is not that great compared to other drugs, but the fact that the activity is repeated so often and in conjunction with so many other activities ties nicotine's reward strongly to many behaviors that we perform on a daily basis, enhancing the pleasure and the motivation we get from them. Remember, teens have learned how to vape, and just like unlearning to ride a bike, it is incredibly hard to unlearn that simple, mildly rewarding behavior of vaping. The frontal cortex, the part of the brain that is responsible for decision-making and impulse control, is not fully formed during adolescence, making youth more likely to take unnecessary risks with their health and safety. Youth are also more at risk for long-term, long-lasting effects of nicotine exposure, like mood disorders and addiction, than adults.
This delay in development is shown here in a study from 2004. In this image, you can see a less mature brain at 5 years of age on the left and a more mature brain at 20 years of age on the right. In this image, the less mature areas are shown in red and green, and more mature areas are shown in blue. This is reflective of the amount of gray matter in the brain. As you can see, the interior and rear parts of the brain develop first, and the frontal lobe, shown right here and right here, including that prefrontal cortex, shown in the red circle, develop last. As you can see, the development of the brain is an ongoing process throughout development into adolescence and into early adulthood. This disparity in brain development in different parts of the brain means that a teenager or adolescent has a prefrontal cortex and judgment similar to that of a child, but has a fully developed nucleus accumbens and is thus capable of feeling the same amount of reward as an adult. There is an overwhelming amount of evidence showing that nicotine addiction, like many other addictions, has a very strong genetic influence. This is just one paper showing the interconnected network of genes that have been implicated as contributing to nicotine addiction. And as you can see, there are many. One such gene are the genes that dictate which subunits are located in the nicotine receptors, which I referred to in a previous slide as being important in playing a role in addictive behavior. As a quick review, this is the receptor, and then these are the different subunits, which are labeled here as alpha and beta numbers. From the drug abuse website, from drugabuse.gov, we see that there are several papers that have looked at these different subunits and how they impact smoking, especially in adolescents. For example, people with primarily beta-3 subunits experience dizziness when smoking their first cigarette, but those with the alpha-5 subunit experience pleasure from their initial cigarette. Furthermore, the alpha-5 and beta-4 subunits are implicated in the age of smoking initiation, and the alpha-5 subunit is also implicated in the increased risk of dependence among early smokers. While these studies all look specifically at traditional cigarette smoking, it is likely that the same mechanisms may be at play with vaping. Furthermore, there are some recent studies showing how nicotine affects gene expression, or the ability of genes to be translated into functional proteins. A study using adolescent and adult rats directly infused nicotine for 14 days, followed by a 30-day withdrawal. Gene expression was examined in the brain after the initial 14-day infusion and then again after the withdrawal period. They categorized these gene changes into 3 different categories. Transient means that the genes were only expressed at 14 days. Persistent means that the gene changes were at 14 days and 44 days. And late would be gene expression changes at 44 days only. The study found that more genes are expressed transiently, only after the 14-day infusion in adults, but significantly more genes are expressed persistently at both time points and later after withdrawal in adolescents. This suggests longer-term effects in adolescents compared to adults. Obviously, more studies are needed to see if this also occurs in humans.
As we continue with the unfolding case study, communication is very vital and important for both providers and parents to keep open with their teens. One of the main ways healthcare professionals establish trust with teens is through communication. Effective communication is critical to build trust and rapport. There are several therapeutic communication techniques that promote quality care. Therapeutic communication is a collection of techniques that prioritize the physical, mental, and emotional well-being of teens and helps the provider to facilitate a healthy discussion. Above are 9 common therapeutic techniques used by providers, and a brief description along with examples will be provided. The first is giving broad openings. Therapeutic communication is often most effective when teens direct the flow of conversation and decide what to talk about. To that end, giving teens a broad opening such as "What's on your mind today?" or "What would you like to talk about?" can be a good way to allow teens an opportunity to discuss what's on their mind. The second is making observations. Observations about the presence or the appearance, the demeanor, or behavior of teens can help draw attention to areas that might pose a problem for them. Observing that they look tired may prompt teens to explain why they haven't been getting much sleep lately. Making an observation that they haven't been eating much may lead to a new discovery of a symptom. The third is exploring. Exploring is whether the provider delves further into a subject, experience, or relationship. It examines certain ideas, experiences, or relationships more fully. Examples of this would include, "Tell me more about that," or "Would you describe that more fully?" Next is suggesting. Suggesting collaboration emphasizes working with the teen, not doing things for him or her. This type of communication encourages the view that change is possible through collaboration. Examples include the provider stating, "Perhaps you and I can discover what causes your anxiety." Or, "Perhaps by working together, we can come up with some ideas that might improve your communication with your parents." The next one that we are going to discuss is focusing. Sometimes during a conversation, teens mention something particularly important. When this happens, providers can focus on that statement, prompting teens to discuss it further. Teens do not always have an objective perspective on what is relevant to their case. As impartial observers, providers can more easily pick out the topics to focus on. The next is seeking clarification. Similar to active listening, asking teens for clarification when they say something confusing or ambiguous is important. Saying something like, "I'm not sure I understand, can you explain it to me?" helps providers ensure they understand what's actually being said and can help teens process their ideas more thoroughly. Next is restating. Restating lets teens know whether an expressed statement has or has not been understood. Reflecting. Teens often ask providers for advice about what they should do about a particular problem or in specific situations. Provider can ask the teens what they think they should do, which encourages teens to be accountable for their own actions and helps to have them come up with solutions themselves. And lastly is summarizing. It's frequently used for providers to summarize what teens have said after the fact. This demonstrates to teens that the provider was listening and allows the provider to document conversations. Ending a summary with a phrase like, "Does that sound correct?" gives teens explicit permission to make corrections if they're necessary. Next, we're going to talk about other assessments that are important to Nathan's history. It is important to gather a comprehensive medical and social history. Although parents may be helpful for some questions, such as medical and family history, it is also common to have the parents step out of the room to ask some of the other questions. Confidentiality should be also reviewed with the teen when it comes to whether it can remain confidential or if it cannot remain confidential. Stressors. It is important to talk about stressors with teenagers. Teenagers, like adults, may experience stress every day and can benefit from learning stress management skills. Most teens experience more stress when they perceive a situation as dangerous, difficult, or painful, and they do not have the resources to cope. Some sources of stress for teens include school demands and frustrations, negative thoughts or feelings about themselves, changes in their body, problems with friends or peers at school, unsafe living environment or neighborhoods, separation or divorce of parents, chronic illness or severe problems in family, death of a loved one, moving or changing schools, taking on too many activities, or having too high expectations, and lastly, family financial problems. Some teens become overloaded with stress. When this happens, it can lead to anxiety, withdrawal, aggression, physical illness, or poor coping skills such as drug use or alcohol use. The SBIRT. The SBIRT is a screening, brief intervention, and a referral for treatment. It is an evidence-based practice used to identify, reduce, and prevent problematic use, abuse, and dependence on alcohol and illicit drugs. The SBIRT model was incited by an Institute of Medicine recommendation that called for community-based screenings for health risk behaviors, including substance use. SBIRT consists of three major components. The first, the S, is the screening. A healthcare professional assesses a patient or teenager for risky substance use behaviors using standardized screening tools. Screening can occur in any healthcare setting. Next is the B and I, which stands for brief intervention. A healthcare professional engages a teen showing risky substance use behavior in a short conversation, providing feedback and advice. The R and the T stand for referral and treatment. A healthcare provider provides a referral to brief therapy or additional treatment to teens who screen in need of additional service. The next one is HEADSSS, the home, education, employment activities, drug, sexuality, safety, and suicide mnemonic, is very useful to remind providers of important information to obtain from adolescents. This approach starts with non-threatening, open-ended, non-judgmental questions and progresses to more sensitive areas such as sexuality, feelings of depression, and thoughts of suicide. The discussion of the presenting complaint or reason for the visit should be addressed at some point during the visit, even if other important issues are brought forward. Explain that all the questions are asked in an attempt to help the adolescent improve their health. And lastly, a suicide risk assessment. Suicide is the second leading cause of death of people from the ages of 15 to 24. This is an opportunity to take and use a validated instrument and screen for suicide. So it is also important to review physical, psychological, and behavioral signs and symptoms of addiction. The next slide provides some examples of each. As you can see on this slide, when we look at physical, being physically addicted means a person's body actually becomes dependent on a particular substance. Even smoking is physically addictive. It also means building a tolerance to that substance, which means so that a person needs a larger dose than ever before to get the same effects. The physical symptoms of nicotine addiction are caused by withdrawal. Withdrawal from nicotine occurs because the addicted brain can no longer naturally produce adequate levels of certain chemicals like dopamine. These symptoms can crop up in as little as 2 hours after not using tobacco and tend to be the worst 2 to 3 days after quitting. Next, we're going to discuss psychological. Psychological addiction happens when the cravings for a drug are psychological or emotional. People who are psychologically addicted feel overcome by the desire to have a drug. Examples include use of drugs or alcohol as a way to forget problems or a way to relax, withdrawal or keeping secrets from family and friends, loss of interest in activities that used to be important, problems with schoolwork such as slipping grades or absences, changes in friendships such as hanging out only with friends who use drugs, spending a lot of time figuring out how to get drugs, stealing or selling, belonging to be able to afford drugs, failed attempts to stop taking drugs. And lastly, behavioral. There are many behavioral changes that a parent or caregiver may begin to notice. As the nicotine starts to change the function of the brain, teens often become irritable, moody, and withdrawn. It is difficult to determine if this is normal teenage behavior versus something more concerning. It is important to monitor for patterns of behavior and if it worsens over time.
This slide reviews the brain areas that dictate some of these behaviors. This includes the prefrontal cortex in green, with anticipating and attaining the drugs, the emotional component of mood swing in the limbic system, specifically the amygdala and extended amygdala during withdrawal, and also binge and intoxication in the nucleus accumbens of the basal ganglia.
So now that we have discussed the introduction, some communication techniques, and gone over predisposing risk factors, we're going to talk about some common interventions for Nathan and his family. So we would begin with exercise. Physical activity is a reliable way to crush a craving. Instead of using nicotine to get the feel-good response in the brain, you are doing it more naturally thanks to the endorphin boost you can get from physical activity. Even a short walk can do the trick, as can something like playing ultimate frisbee, taking a swing at the batting cages, or doing yoga. The next is distraction. Cravings will pass if you give them a minute or two. Purposely using a distraction to take your mind off the craving will help speed up the process. Find the activities that will keep your mind engaged for those few minutes. These can include things like reading, listening to music, playing a game, solving a problem, or doodling. The next is try to set up your environment for success. Create a temptation-free home, such as throwing out anything that reminds you of vaping. Make sure your room, backpacks, pocketbooks, and pockets are free of any e-cigarettes and things that you need to vape. Then let your friends know that you're trying to quit so they don't bring vaping items around you that can trigger a craving. Fourth, find stress solutions. Many people turn to vaping when they're stressed out, which sets up a vicious cycle of cravings. This way of confronting stress is only a band-aid. Now is a great time to examine stress coping skills. Developing healthy, effective alternatives to stress now will benefit you for the rest of your years. Things as simple as deep breathing, drinking water, or talking to a friend are ways to re-energize yourself and let the stress go. And lastly, celebrating accomplishments. Recognizing and celebrating accomplishments when you're quitting can boost resistance to stress and cravings. Even making it through your first few hours is a big accomplishment. Each and every moment tobacco-free is a moment to be welcomed and celebrated. Next, we're going to talk about some common treatment goals. Teen vaping has whipped through this country like a tornado and leaving very little treatment options for teens and families, which has been extremely frustrating. First, seeking treatment. For a few families, inpatient rehab can be an option. However, many families are looking for outpatient treatment, and many facilities for addiction are limited on taking under the age of 18. Counseling. Counseling is an excellent option for many teens and families. It is a good way to explore stressors and ways the teens react to those stressors. It's a time to examine poor coping mechanisms and replace them with healthy alternatives. It may not stop the problem immediately. However, over time, vaping may cease due to increased self-esteem, forming better habits, and increased education. Cognitive behavioral therapy is an evidence-based treatment approach that lets the teens focus on feelings, thoughts, and behaviors. It is based on the idea that if we change our thoughts to be more realistic and positive, we can change the way we experience life. The next we're going to talk about is pharmacological. For adults, it can be much easier. There is a nicotine patch or gum that have been treatments to help stop smoking or vaping. However, the patch and gum are approved for those over the age of 18. Health providers are grappling with ways to help teens since this alternative does not currently exist. And lastly, relapse prevention. Once the teen has stopped vaping, it is important to have parents still monitor for the signs and symptoms of nicotine addiction. Education is always key to helping prevent a relapse for both the teen and helping the parent. Having open lines of communication between both will also be beneficial. This would also include identifying potential triggers to vaping, learning skills to regain abstinence of vaping, and adopting healthy coping and stress management skills to address the triggers. So now we're going to discuss what resources are available. To be honest, resources are scarce. E-cigarette use has far outpaced science when it comes to finding treatments for nicotine dependence. It is an epidemic because there is no help. The Truth Initiative text program has expanded its quit smoking resources to include a first-of-its-kind e-cigarette quit program. This initiative and free text message program was created with input from teens, college students, and young adults who have attempted to or successfully quit e-cigarettes. This program is tailored by age group to give teens and young adults appropriate recommendations about quitting. The program also serves as a resource for parents looking to help their children on how to stop vaping. For some parents, talking to your teen is difficult. Above is a tip sheet from the Centers for Disease Control, or also known as the CDC, on how to start difficult conversations and promote healthy dialogue. So staying ahead of the trend. Unfortunately, vaping has made things trendy again in the tobacco industry. The 2018 National Youth Tobacco Survey showed an alarming surge in e-cigarette use. Vaping is now the most popular way for adolescents to use tobacco. From 2017 to 2018, usage rose by 78% for high school students, an alarming 48% for middle school students. Many kids falsely believe e-cigarettes and other tobacco products are safe. Some don't even realize they contain nicotine, but these products can deliver much higher concentrations of this addictive drug than traditional cigarettes. As I mentioned before, a Juul pre-filled liquid pod contains as much nicotine as a whole pack of cigarettes. According to the U.S. Surgeon General, exposure to nicotine during adolescence can cause addiction and harm the developing brain. But there's no safety helmet to protect kids from this growing danger. The top 3 reasons teens are using e-cigarettes are use by a friend or family member, appealing flavors like mango, mint, fruit, or chocolate, and belief that they are less harmful than other forms of tobacco. Remember, safer does not mean that it is safe. Vaping has been advertised as a safer alternative to cigarette smoking. This does not mean vaping is safe. Staying in the know. Sadly, there are even more tobacco trends tempting a new generation, including flavored cigars, tobacco pipes, smokeless tobacco, and new oral products such as strips and lozenges. And while these new products are usually marketed as being safer than smoking, don't be fooled. Recent research has found that the flavoring chemicals may be toxic and lead to serious blood vessel damage, and we just don't know enough yet about the long-term effects. Urge teens to say no. That is really important. As providers, it is important for us to educate ourselves about these products so that we can counsel kids, teens, and young adults in our sphere of influence. The simple fact is, no tobacco product is safe. This concludes this IBHC module. Thank you for watching, and you can find our references on the next 2 slides.